Most commonly asked questions, burning questions you had always wanted to ask the plastic surgeon next door. Hi, my name is Dr Vincent Tay. I'm a board-certified plastic surgeon with the Artisan Group. Can the patient preview what they will look like after surgery? So there are various techniques or methods to do that. In this day and age, we tend to use a 3D simulation to give a simulated appearance based on different sizes, different shape of implants as used, and different placement of where the implants are actually put into the body. So the next question is a long one. How do I decide the site of the incision and the placement of the implant? The three most commonly used incision includes the one at the axilla, at the armpit, the one at the areola, or what we call the nipple, and of course, lastly but most importantly, at the breast fold. The last method at the breast fold is believed by most surgeons to be the cleanest and offers the best control of implant placement. The next question is, what are the types of implants? Broadly speaking, in terms of shape, there is the teardrop and the round implants. There are three main types of texturization. The first would be that of a smooth implant, where when you run your fingers through it, it feels totally smooth, like a sheet of plastic. Next, of course, is that of textured implant or macro-textured implant, where there's a slightly rough surface. There is also a third category of texturization that's referred to as either micro-textured or nano-textured. When you run your finger through it, you feel a bit of texturization, but not too much. So the texturization of implant affects various considerations. When you are using a teardrop implant, there is a potential small risk of malrotation. So in implants that are teardrop shaped, we tend to use a textured implant because it gives a Velcro effect to your body to reduce the risk of malrotation. Texturization at the same time reduces the risk of capsular contracture based on various studies. There are also different types of gel that are used other than the commonly known more cohesive gel. There are also lighter gels that have now been improved, so to speak, 20 to 30% lighter than pre-existing implants. So one may ask, so what's the benefit of having a lighter implant? Well, as we know, implants are non-living tissue, so it does exert a certain stress on existing tissue. So because of that, if the implant is lighter, we are talking about less stress on the breast tissue. This, in the longer run, would result with a lower risk of bottoming out, lower risk of droopiness, especially when the patient gets older and the skin tissue can become a bit more lax. How many cup sizes can I go up? I have to say that cup sizes can be rather misleading, because in a smaller size patient, a 300cc can make her a D cup, for example. But in a bigger size patient, that 300cc may only make her the C. So I often prefer to use a 3D simulation to educate the patient for better prediction and estimation of what she will become based on the implant size that she's choosing. I would say in general, most patients coming seeking for breast augmentation will try to achieve what will be perceived as a C cup. Then as to how much augmentation, I would say to make it naturally appearing, it should be one where you walk into a restaurant and people will look and they see something pleasing in contour and size, but they can't quite put a finger to it whether there was a breast augmentation done or is it something natural. I think that would be an ultimate test of the choice of implant augmentation. So the next question is, must the surgery be done by an experienced surgeon? I would say that in the hands of an inexperienced surgeon, the chances of complications from the surgery will be increased. Okay? But in the hands of an untrained surgeon, conduct of an operation like this may potentially be dangerous. Well, some of the complications we're talking about includes wrong placement in terms of implant position, resulting in a poor cosmetic outcome. It could also result in complications like infection, implant rupture, or even early malrotation.